Now with negative deviation, here you have the norm and the body temperature decreases below the normal levels, below the norm. Like if you have the normal as this, maybe 37 degrees Celsius, and that's the norm. Now the body temperature, the core temperature, falls below the norm. Maybe if the core was 37, the next time you measure, the core will be kind of like 34. And this is too much. Okay? That's too much. That it requires immediate intervention. So now the question is, how is the body going to intervene? It is simple. That blood that will be passing through the hypothalamus together with the skin, it is going to be cold. And so when that cold blood passes through the hypothalamus, remember you'll be having a hypothalamic set point, and so on. So it will compare this blood and to the set point and be like, no, this is too much. Certain things will need to occur. And so that's when the cold thermoreceptors, they will activate the heat gain center in the hypothalamus. And when the heat gain center is stimulated, then it will in turn stimulate the respective organs that will undergo certain physiological and behavioral changes to bring back or to restore the normal levels. So now you should be wondering how the body is going to manage that, and it is simply the opposite of the other one. The opposite of what we've just seen. Now the sweat glands, they must be inhibited, because I've never seen anybody sweating when it's too cold. And there is nothing like unless even, because I've never seen. Okay? I've never seen anyone sweating when it's cold. Then the erector pili muscle contracts. And when you contract, you pull the hair follicle down and then the hair up, or the hair stands. Now the standing of the hair, it is not effective for 1 or 2 or 3 hair cells, but the entire hair on the skin. So if you have all hair, is it all hair or all hairs? So if all of them are standing, then these air molecules, they will trap a layer of moist air, which will act as, now here I'm free to use act as. You use it in an exam, I'll cross you. But depending on what you are describing. Now this layer of moist air, it acts as a barrier to losing heat. Okay? Now this barrier, it prevents excessive loss of heat, and hence conserving some heat in the body. Remember, it's too cold, the body is feeling cold, temperature is way below normal, so you need to conserve even the little heat that you are producing internally. Even the little heat that is available, it should be conserved. Okay? And so there are these erector pili muscles that do that part as far as conserving is concerned. Then the blood capillaries that supply underneath the skin, they undergo vasoconstriction. Okay? And when they undergo vasoconstriction, then the shunt vessel, okay, the other one, this one, it's here, I believe it's there. I think it is, yeah, there. So now, if this is our blood capillary, this will be our shunt vessel. Now this one connects directly venules to arterioles. Okay? Now, the shunt vessel must contract so that you loosen, you narrow the diameter of this shunt vessel. And then these ones, the blood capillaries which supply underneath the skin, they should dilate. These ones which supply at the surface of the skin, they should dilate so that large volumes of blood are pushed to the surface. And when they reach the surface, the concentration gradient between the blood vessels, these capillaries, and the surrounding environment is going to be so high, okay, that the ions together with, sorry, the heat, the excess heat, sorry, I'm over here. Yeah, it's okay, it's okay. I had to attend somebody. So now, the blood vessels, remember, you have to conserve heat inside your body, and as a result, the little heat inside your body must therefore be maintained. You must be stingy. You must be mean with the heat inside. Now, remember these blood capillaries, they are almost in direct contact with the external environment. Okay? External environment. Sorry for that if I disturbed a bit or if it's okay. They are in direct contact with the external environment. So what happens is, if you leave blood to continue flowing normally in these blood capillaries, okay, the diffusion distance between this blood here and the external environment that is too cold is going to be very small. Did I say diffusion gradient or diffusion distance? I think diffusion distance is going to be too small, that the rate at which the little heat is diffusing from blood into the environment is going to be high. Now, to cut off that, to prevent that, then these capillaries, okay, these capillaries that supply the skin, they will constrict or they will contract so that you reduce the diameter. And then the shunt vessel, this one is going to widen, is going to dilate so that its diameter increases. Hence, almost all blood is going to be channeled into this. So you reach here, it is hard to cross into this, but it's easy to cross into the shunt vessel. So almost all blood will channel and cross through this shunt vessel and continues to the venules. Hence, you prevent heat from being lost from your body. Then there is secretion of adrenaline and thyroxine hormones, which will increase the rate of metabolism. And so when you increase the metabolic rate, you produce, or much heat is going to be generated internally, okay, and then it is that heat that will be used to raise your body temperature. And finally, the skeletal muscles and the smooth muscle, actually the skeletal muscles, not smooth muscles, leave the smooth muscles. Remember, we saw the skin so that it has 3 layers. You have the epidermis, you have the dermis, the subcutaneous layer. Now, under the subcutaneous layer, you have there the skeletal muscles. They are the ones which attach the skin to the bone, to the skeleton. Okay? Yes. Now, the skeletal muscles, they will undergo rapid contractions and relaxations. And it is involuntary. You have no control over it. Even if you want it, or even if you don't want it, it will happen. That's why when you were young, like when it was always cold, you hear yourself, ah, and then the teeth, you know that feeling. So it is involuntary. So they will undergo rapid contractions and relaxations rapidly so that the metabolic rate in these skeletal muscles is increased to produce much more heat. Okay? Much more heat, which is going to be used to maintain our body temperature constant.